team. And we've been having lots of fun while we're doing it. So today, what I'm going to do is I'm going to give you an overview of the electronic medical record, or EMR. And I'm just going to switch off my camera and we'll get started. One moment. And we'll just make sure the screen's coming up. And
you can see your
any bigger. Oh, wrong way.
There you go. We can see it, and it's a good size, Lee.
Okay, excellent. So when we come into Expanse, into our electronic medical record, one of the choices that we'll have is, especially if you work at more than one site, you actually can change the site that you're working at. And today I'm going to do a demonstration out of our Headwaters site. And you'll notice now that I'm at the facility of Headwaters. For most of the clinical folks, they will have a clinical menu, and they will have PCS, the patient care system, specialty care desktop. They may have CER or EDM. This is where the physicians do most of their work. And then we have our administrative and ancillary and other modules, including ambulatory. So for today, we're going to start in the PCS status board. And when we go in, I've already added some patients to my list, and I think you've seen some of that in some of our earlier demos today. But I also have some other options. So I can go through lists, I can have my list, I can go to any location, and the locations for Headwaters will come up. And I could choose the intensive care unit, and I would have a list of patients there. And then I could add those patients to my list as I needed to. When you are at this main landing page, you'll have a few different options. There are some patient reports that will be available. We can look at any location reports. We can go into risk management from this main page, or I can open the chart for my patient. One of the things when you are first landing, when you highlight a patient, you'll have more information up in the header bar. So we have the patient's name, their age and sex. We have their birth date here as well, which when you're doing, very helpful when you're doing the double check of patient's identification to have it right at your fingertips. You'll see whether or not they have a code status ordered or if there's any history. Their height and weight will appear here, as well as their BMI will also appear here, and any allergies or adverse reactions that they may have to medication. On the right-hand side of the green header is our account number, so WA 54/20, as well as our unique record identifier. On our status boards, the other things that you will see are the room and bed that the patients are in. Their age and sex also appears. We have pink is for female, blue is for male. We have yellow for unknown. Those are the three sexes that we have within our system currently. We have our patient name, our attending physician, and we also have our special indicators, which I'll get to in a little bit. We also have added a C column here, and this is our patients who wish to be identified as confidential. Like our current system, if a patient has been designated confidential, you'll also see a small c in brackets beside their name. But we just felt that it was important to really sort of bring attention to patients that are confidential, because we need to manage them a little bit differently, especially if you're getting any phone calls. Patient submitting diagnosis will always appear here. And the surveillance module, if the patient has any of the indicators that they are triggering, such as COVID, they will appear under the surveillance column. The precautions here are the precautions that we need to take with patients before going into their rooms, so whether or not they're on airborne or contact precautions will appear in this column. I just have to scroll a little bit further along. This is what we call our generic status boards. We've actually developed some specialty status boards for areas like the birthing unit and for our allied health practitioners, and I'll show you that in a moment. But in this, we can look at any outpatient orders that may be coming up. If the patient has new results, they will appear here. If there are abnormal results, they'll be in yellow. If they're critically abnormal, they will be in red. UNC is for our uncollected specimens. So if a urine specimen has been ordered on a patient, you will see UNC in this column, and that you'll know that you have a task that needs to be completed. The next task button lets us know if something's coming up or if something's overdue. So in this case, I've been a bit delinquent in documenting on my purposeful rounding, and that indicates that here. One of the nice features of Expanse is that we've actually got a home medication column, and this indicates whether that best possible medication history has been collected. Once it has been collected by the pharmacy folks, you will see confirmed here. And so it's very easy to see who has or has not had home meds collected. The other thing that the status board does is it lets me know when I have medications that are up and coming. If they are in red, they are overdue. If I have a patient who's having a transfusion, you'll see information in the TAR column. If a patient has had a referral over to home care, it will appear here, as well as if a patient is to be transferred or to be discharged, we'll have an indicator here. And then our last column on our status boards is about the hold queue. So if a physician has put some orders in that are currently in the hold queue, you will see an indicator here. One of the other parts of the status board is what we really call sort of a secondary detailed panel. And this provides us with a snapshot before we even go into the patient's chart of key information. So we can look at their vital signs, any communication orders that may have come across for us, when a MAR assessment is due. So if we've given something for pain and we need to reassess that pain level, it will appear in this section, and whether or not they have IDs. And as I mentioned, we do have status boards for some of our other groups as well. So when I take a look at lists and I take a look at Headwaters physiotherapy referrals, their status board looks quite a bit different. Some of the things are very similar. Room, bed, age, sex, admission date, diagnosis is there, their name, any special indicators. But if they have had a referral for physio and it's a new referral, they'll see a green check mark there, and they'll be able to act on that referral and start care for that patient. The reason for referral will appear here as well. And as they update it, you'll actually see for their status board that whether treatment is underway or not. So that's our status board. It's really a landing page, and it really gives you a good snapshot of what is happening with the patients that you happen to be caring with. When I open my chart for my patient, I no longer have to move between my documentation and my patient information because it really is all in one place. The header follows over to the chart. Again, all that information is there. If I look under the I button here, I can actually very quickly see any information about their allergies, their height and weight. I can look at their code status if they have one entered. Okay. And then on the right-hand side, this is really where we will do the majority of our work. I can go back to my status board by clicking status board here, or by closing this patient's chart with using the close button. I can select the visits that I want to look at. So if this patient had had more than one visit, I could actually choose to look at information from, I'm laughing because this patient is coexisting between Royal Vic and Headwaters at the same time. However, I could choose to look at just their outpatient visits or their inpatient visits, and I can look at a time frame. And what that means is that on the EMR portion of this chart, I can see physician reports from 2 years ago, if they are there. I'm going to come back to the summary panel. I can very quickly click on review visit, and this will just give me information about who my attending physician is. So if I need to reach out to a physician, I will see their information here. Patient messages is a new functionality, and what this does is it allows us to communicate non-urgent communication to physicians. And if I wanted to take a look at it, I can click on it and it then will show me what that message is about.
Oh my God, you're so congested and everything. Yeah.
Under the clinical panels, and these are still in development, we're working on these with our working group to help them determine what information is the most important information that they need to see. This information is available throughout the EMR, but the clinical panel allows us to put the information all in one place. So if I take a look at the vital sign clinical panel, it will show me my patient's vital signs. Again, this continues the same as our current system. Yellow is abnormal, red is critically abnormal. So it puts my vital signs in, and if I had more than one, it would show them. But the other thing it does is it allows us to actually do a comparison of our active medications against what our patient's vital signs are doing. And it also allows us to take a quick look at our intake and output. So this is the type of grouping of information that we can do in clinical panels. We can change, you'll notice along the bottom, the rate that we're looking at. So for a patient who had more frequent vital signs done, we could choose 15 minutes, we could choose 24 hours. The other thing that we can do is if we click on something, we actually can then graph that information and look at it graph over time. And it's just very quite intuitive, very easy to move around in this particular view. The other option I have here is I can just click on another panel. And so even if my patient didn't have heart failure, I could take a look at the heart failure panel, which has quite similar information on it actually. But we have been working on a few others. For example, for our critical care TOA, and their clinical panel is a bit different. So they're looking at meds first, vital signs, etc. So those are all under development with our working groups. We can just look at vital signs by clicking on the vital signs, and this again is part of the EMR. As the patient has more vital signs entered, more columns will appear. And again, they can be graphed as well. For intake and output, you'll notice down at the bottom we have a few choices. So we can look at the 24-hour cumulative totals or the length of stay cumulative. We can look at 1 hour intervals or 4-hour intervals. And again, we can graph. So if we wanted to see how that oral intake was going over time, maybe they have better times in the morning when their intake is up as opposed to the evening time. And again, we can choose any interval along the bottom that we would like to do, including over years. Hopefully we don't have patients for that long. I think in one of our sessions yesterday, we talked about the medication. And again, this is the EMR part, it is our viewing part. So when we click on MAR under the medication panel, we can't actually document here, but we can view. So we have a list of medications. We can look at medications for all visits, and it will give us information from all of our visits or just for our selected visit. When we take a look at the medication snapshot, it provides us with the patient's home medications, medications on admission, and then if we had medications for discharge, we would see them here as well. And some of the columns, so status, you'll see whether it's a new medication, whether we're continuing a medication that they were on at home, and those will all appear there, and also when they were started and stopped. If a patient was on any infusions, so an IV normal saline at 125 an hour, we would see it here. If a patient was on an IV dopamine drip at 5 mics per kilogram, we would see that here as well. And again, this is just viewing. So on our critical care panel, for example, we would probably look at vital signs against our titration. The lab panel will actually have lab results. And again, yellow is abnormal, red is critically abnormal. Microbiology specimens will appear here. And I should try and find patient with a micro to show you a little bit better. I think we've seen blood bank reports. So any reports from any of the physicians will actually appear here. Our surgical reports will appear here. And anything that anybody is doing as a formal report. This would include some of our imaging reports as well. In patient care, what we will see is any documentation that has occurred by our care providers. So nursing, allied health, our documentation will all fall into this patient care as opposed to reports, which is where we will tend to see reports from physicians, nurse practitioners, etc. We can look at documentation just by name, so that we can take a look at that. And we can view a snapshot or view the history of it. Same with our vital signs. We can look just if we wanted to see documentation that had been done by the nurse on the ship before us. We could look for the documentation that they did. We can also do provider type. So if there was, we're looking for the physiotherapy documentation, that would appear underneath here. And again, this is just all viewing of information. Under notes, we can actually see any notes the patient may have on them by clicking this. And then viewing selected. If we had chosen more than one, we would be able to scroll down through the note. Our notes would be identified by being electronically signed, and their date and time appear here. Similar to ambulatory, or pardon me, to some of the other things that we have seen, is that we can actually amend a note. It will not, an amendment will not erase the note that's seen here, but we can, even from this viewing, is that we can add when I type in my amendment and click on OK and then save it, I have to put my PIN in. And now you'll see that there's a note and that there was an addendum put on that. You can actually, if you've been on the screen for a while and you've been waiting for a lab result to appear, you can actually hit refresh EMR. And if there is a new result, it will, these sections will appear red. So if a new lab result would come in after I hit refresh EMR, this would be red and I would know my lab result was in and I could take a look at it just by going over to lab to click on it. When I click on orders, I will be brought into the current orders that are on a medication or on a patient. From this screen, and this is where we start to slide into the doing part of the patient care system, is that I can enter new orders. I would choose my physician and have me give me a verbal order. So I could click on new orders. Very intuitive here that I could type in that I wanted a CBC to be done. If I wanted to enter any new medications, I can enter them here. It will bring me up to a screen where I'm able to enter orders. We'll check PO. I have to go next because then after that I would need to define the drug dose that I wanted this patient to have, or the physician ordered for me. And then if I wanted the dose given today as opposed to Friday, I can actually make that change here by editing. And then once I finish entering my orders, I would hit submit. I need to enter my PIN. When I do this, these orders will go over to the physician for him to sign. The other part of viewing that is very unique to Expanse and which is providing us with quite a valuable tool is what we call the snapshots. And it really provides us with a snapshot of information about the patient, and that we can use this when we're doing transfer accountability for shift to shift. We can use it if we're covering for someone so that we can have that quick snapshot of what's happening with the patient. So our working groups have worked very hard on looking at some of the things they would like to be able to use on their transfer of accountability. And so you can use a snapshot on any patient. I could use a critical care snapshot, but you'll notice it's a little bit busier than, say, for our regular inpatient transfer of accountability. So in the critical care world, they're more interested in pain levels, the drains and tubes. If the patient's ventilated, when they click on the plus sign, that information will appear below it. They're also looking at our physical assessments, IV lines, INO, and hemodynamic. I go back over to TOA for a moment. Some of the same things are here, but obviously we wouldn't necessarily have a vented patient on an inpatient unit. But very quickly I can take a look at the vital signs as they've been recorded. Oh, let me just refresh that. Oh, it's not helping me. There we go. And then my vital signs would appear there too. We've also developed some TOAs when we're transferring patients between units. So when we're sending a patient from our emergency department over to our inpatient units, we've looked at the things that we need to communicate to each other. If there are next tasks or interventions that need to be done, they will appear here. So you'll see on this list in particular that the patient has a medication that's overdue at 9 this morning, that purposeful rounding. And from here, if I've finished reviewing my TOA, I can actually go to my medication administration record, or I can go to the work list to complete those tasks. The other thing that we do have is something called the bedside bulletin. And this is kind of like the post-it notes that we would have put on a patient's chart. So it's things, or on the Cardex, because the Cardex goes away with Expanse. And these sort of snapshots and clinical panels are going to be what sort of supports us in the work, as well as the work list of what we need to do for our patients. So for example, I might not see right away that the patient's being booked for a CT chest with contrast on Monday, but when I'm giving TOA, now on Sunday evening, we can say, okay, he's having this CT of his chest with contrast tomorrow. He needs to be NPO. They want to give him some fluid before he goes. And these are things that we can actually compose sort of on the fly or compose by date. We are putting in the date that we are putting that in. And I believe it will always display the person who has been putting it in. And because I'm responsible for this note, I would be the one that would need to remove it. These snapshots are not limited to our nursing. We've actually developed snapshots for our respiratory therapy groups, for OT, PT, speech language pathology. And there are some what we call widget options where we can add things to our snapshot widgets, but that will be covered in training. So we're really starting to get down into sort of more the doing part of the EMR. We can, under plan of care, very quickly have a look to see what has been ordered or what the plan is for this patient. So if we had a care path intervention, you would see it here. standard of care for medical patients. When they are admitted, it will show me the interventions that have been ordered for this patient. It will also tell me whether they're active or not, and the day that they started and the frequency that they need to be done. It also tells me when they were last done. I can see this from the work list, but if I want to know what's on that standard of care, I can see it here. If I just wanted to take a look at interventions, it would pull the list in. You can actually add interventions here too if I wanted to. But for our 24-hour chart check, we can actually say that we've reviewed the intervention and that we have agreed that we have looked over the patient's entire plan of care. And when I click on yes, it will record that I have actually done that review. On our work list, let's keep an eye on the time. So on our work list, these are the things that we need to help our patients with. The first column tells us where these interventions are coming from. So A is for an assessment that's been added. AO is an ordered assessment. So for example, the referral for physiotherapy was ordered by the physician. An IO is an ordered intervention. And in this case, the patient's been ordered the bowel protocol, bowel management protocol for us to do. The other thing about our work list is that we can take a look at the frequency that something needs to be done. So for example, the nutritional screening tool needs to be done every Monday at 10. The grading scale assessment, or I think Wound Wednesday at RDH is Wednesdays at 10. And I was going to say, right, Fall's Friday. So we do our fall risk assessment on these patients Friday at 10. And so when Friday gets a little bit closer, we'll start to see a clock, which will tell us that that needs to be assessed. Some of our care items also have protocols attached, and you'll know that because they have a small P beside them, so that we can very quickly look at the definitions that we might need to remind us of every once in a while about, what completely limited sensory perception is and what moisture is. And then we can close it when we don't need to look at it anymore. Under the I, it will actually give me any detail about that particular care item, letting me know for the grading that we need to do it on admission and then every Wednesday, and that bed and chair-bound individuals should be reassessed for their risk, especially patients with pressure ulcers. Click on the back button to get out of there. The other thing that you'll see in this column is when something was last done. So my vital signs were last done 2 hours ago. They're ordered every 4 hours and 49 minutes overdue. And then the clocks will appear when something is due. So for example, under purposeful rounding, we will see a clock that will appear when I need to do that. When I want to document, I could just click on my Now column and then click on Document. And again, once these things are documented, then I would File, and say that's it. And you'll now see that that is done. And I can hit refresh, and that done will go away. Again, this is the doing part of the electronic record. So we've already had a demonstration on medication administration. We can choose to write notes from here, and these are divided. I would probably have the entering a nursing note, and then I can pull in some of my text. So I might want to document a note on the patient's with a focus of cardiovascular, and then I would document the rest of my SOPI note, enter my PIN to sign my note, And you'll notice now notes up here for viewing is red, and it would be red for any other person coming on. They would know that I had entered it. The last thing in the columns are TAR, and that's where we would do our transfusion administration record, and then our discharge plan will be used when we are discharging patients. We're going to come up to the summary panel because it's a bit of a unique beast in Expanse. It's up here with all the viewing, however, it is also a bit of a doing tool. And we saw some of this both in the ambulatory and if you saw any of the physician sessions, they actually have something similar. And this is information that we want to share visit to visit on a patient. So that if I have recorded, for example, patient's allergies on my emerge visit, I'll be able to see that on my inpatient visit or on my clinic visit. So it really is about that sort of all our baseline information about our patient appearing in one place. So across the top, you will see that this first tab is really about clinical information. We also have what we call legal or indicators. The one we're probably most familiar with is whether or not the patient has a code status. And we're still doing some work about whether or not and how we're going to record if a patient has advanced directives or a living will, if a patient has a power of attorney for medical care or finance or personal properties. And again, these are things that we need to work through with a broader group. Under demographics, what I will find here are the patient's demographics, where they're living, what their phone number is, their medical record numbers, and you'll notice this patient has a medical record number at Headwaters, one at Collingwood, and I'm not sure about N, and Royal Victoria. You'll see whether they're employed or not. Marital status, ethnicity is here. We can look at their guarantor, and we can look at their contact information. So if you're looking for who you should contact about your patient, whether it's in this case a daughter or a partner, that information will appear under contacts. Insurance information, whether they're self-pay, whether they're OHIP, will appear here. And then to get out of the screen, I'm just going to hit cancel. As we build Expanse, we'll start to see some of the patient's appointments that they may be booked for here. Any referrals, surgeries, and the care team. So these would be the physicians that have been looking after this patient, involved in their care. If you click on that plus sign, this is kind of handy. You'll see information on that particular provider, and if their phone number has been captured, it will appear. If I go back to the clinical tab, I'd like to talk a little bit about special indicators. Maybe in a minute. There's two things that appear here, and both of these things, both the active problems as well as problems that have been resolved or ruled out by the physicians, will appear here. So in this case, a physician has added that the patient has a problem with depression, and when it was first identified on their record, if they have diabetes and hypertension. Under the resolved or ruled out, as an example, they no longer have cholecystitis because they have had their gallbladder removed. Patient history. So this history really comes from nursing and allied side of the house. It's divided into several sections. We have our medical, surgical, and family history, as well as our social history. And again, these are things that are going to follow the patient visit to visit. I can review the history, so if I've interviewed my patient and they have no other medical history than depression and hypertension, I could just click on review, and that would be recorded in the system. I could actually edit, and when I do this, I can actually do a search. So if I wanted to put in hypothyroid, I could just type in hypothyroid. Um, and then that would appear. And I save it. Refresh. Right, saved it. There it is. Surgical history. What I can do here is that you can actually do this pick list. So if I knew that the patient had a cholecystectomy, the most common ones appear here. If I don't see it, I can search for it. There's probably an easier way.
Under the surgical pick list, Elaine.
Thank you.
Or else you have to prefix it if you're in the big list. So at the bottom of that pick list, the common surgical one should be there.
Thank you.
I'm not sure how many they put in there, but
let's have a look. There we go. The history of heart surgery, just to keep it simple. You'll notice it's green. That means I haven't saved it yet, so I can save it. I can also review it here. And I can click save. And when we come back out here, you'll see that it was last updated at 1458. We can actually look at family history as well. So particularly say in our patients with diabetes, with coronary artery disease, we can record family history. We have options of viewing by condition or viewing by member. So I could edit this. And so I could pick that. I can add a member here to say that mother had a history of diabetes. If it was also on the father's side, I can add that as well. So now we've got a history of diabetes for a family history, and I can save. Social history is something that is new with Expanse. It's giving us an opportunity to share social history across patient's visit. It looks a little bit different from the other screens we've been documenting on. So I can document about how a patient identifies gender-wise, whether they need an interpreter, whether they live alone, and where they live. There are a few tools within our social history. You can document on their family and community support. We actually have a few tools like the loneliness scale that we can document on. That is a new tool. Their financial background, education, dietary, physical and leisure, as well as substance use. So tobacco, alcohol, other substances, and we actually have the page tool in here to measure sort of that problem with alcohol.
Elaine,
yeah.
just want to let you know it's 3 o'clock, so we're only got 10 more minutes left.
Okay. I'm hoping to get back to special indicators, but for some reason I don't seem to have editability this afternoon, so I'm going to go back in just a moment. The other thing that we do have in here is some questions about personal safety, and these are questions that we probably need to be asking some of our patients. Okay, which should bring us to special indicators. Okay, so under the summary tab is what we call special indicators. These indicators are meant to keep patients safe, but they're also meant to keep staff safe. And so it looks like a very long list. The majority of people will not be seeing the IPAC indicators. These indicators will be used by our IPAC clinicians to identify when a patient has had something go on. So for example, C. diff, or whether or not they've had ESBL, or whether it's been cleared, or whether they've been exposed. And that becomes very important when we're looking at additional precautions. For the most part, our indicators that we'll be seeing are things like our care plan for adults, so adult patients with complex needs, or pediatrics with complex needs. If a patient is a fall risk, we can add that. We can add more than one special indicator. So for example, if we had a person of Indigenous origin, this indicator you'll notice has a screen below it. And we've worked with the Indigenous navigators on the language here. For this indicator to be used, the patient has to indicate they wish to be identified as an Indigenous person. We have an opportunity here to say which they're identifying with. And then at Georgian Bay or in the cancer program, RVH, we ask them if they would like the Indigenous navigator to assist them. Once we put the indicator on, we will save it. And then it will appear here under the summary panel. When we go back to our status board, we will see our special indicators. All right, questions?
Elaine, there is a couple.
Okay.
So, oh, I'm really echoing. Someone else echoing. Okay. Amanda Sturgeon is asking, are we able to filter medications? Would I be able to filter and only look at antibiotics on the patient that I had so far since admission?
Yes. It's easier to do it, I believe, from the MAR, but you can, I think you can classify by drug class on the MAR.
Yeah, on the medication list, if you could you could click on that drop down under drug class if this patient doesn't have any.
Oh, sorry. See, my screen's so big I can't see drug class anymore.
Yeah.
So, yes, the answer to that is yes, you could. And there you go. And it lets you know that the filter's applied, which is nice because then you aren't missing anything. And then you can just remove the filter.
Okay. She says, thank you. Okay. Simon is asking, do any of the values in the social history get pulled into the patient header? Example, gender identity.
No, not at this time.
Okay. There's no more other questions. If anyone else has questions, you want to put your hand up or speak out to us so we can help you out. Elaine, sorry, did you go over allergies?
Very briefly. Let's have a quick look.
If we just have a couple minutes, if you want to just.
Yeah. So under our allergy tab, which again is part of this very special summary panel, we can enter new allergies. We could actually, if the patient has no allergies, we could say that they were NKA. We can edit that. We can remove it. We can put unattainable. So if the patient's unable to respond, we would say unattainable. But if they did have an allergy, everybody's favorite, unattained allergy for this patient. Unless it's red, that means I've left something undone. So it's asking me for what the response is for the patient when they are exposed to peanuts. I'm going to say urticaria, and then I can save that. And now that allergy will appear here. It'll also appear at the top of my header as an allergy.
Okay, we got a couple more questions. Lynn Bajard is asking, can we add history of MRSA, SBL, VRE, etc. if we cannot access the IPAC?
Ah. Yes, you can.
Elaine, I think that she means like can staff add it, but it's just IPAC that has access to
IPAC can add
To
the
the
special indicator.
indicators.
But if a patient comes in and
Oh.
says, I've had MRSA, you could say
Yes.
history.
Oh, okay, I see.
Yeah.
Perfect.
We could put that in the pick list if we need it to undersert as well as a maybe a section.
You need it here.
For what do you call them? AROs.
Yeah. And actually it's there already under other.
Oh, it is?
Does it give you like a date if you put it in, or it just says history? It
If I
doesn't
say history,
You can put the onset in, and you get a calendar, and you can put an actual date, or you can do an approximate, or you can say unknown.
Okay, perfect.
Great. Okay, and we only have 3 minutes left. We have one other question. Why don't you save that?
Okay.
Nicole Moore is asking, if a patient message is added, will it flag on the status board?
No,
because
it will.
we aren't using it for nursing.
It's not nursing to nursing. It's really nurse to physician. However, we do on the status boards, on some of them, and I know we've seen this in the emerge area, and maybe something worthwhile to take back to our working groups is that you can add a comment down here in the details that is free text. So that might be something that's useful.
Okay, there is no other comments, Elaine. Great job.
All right, thank you.
All right, we have till 3:15, so you got a few minutes until our next OBS Matt Child demonstration coming up.
That was fantastic. Thank you, guys.
Yeah, thank you.